Hello?
Phyllis, which pill do I take in the morning? I can't remember if it's pink or a blue one.
Remember, Dad, pink by the sink, so take it with your morning coffee, and blue sleeps next to you on the bedside table, so take it at night. Hello?
This is Jason Smith, your dad's landlord. I know your dad has a hard time remembering things these days, but he is 2 months behind on his rent, and I really need to be paid. I tried to explain it to him, but he didn't seem to understand.
I'm sorry, Jason. I'll help him write the checks this afternoon. Thanks for understanding. Hello?
Phyllis, the bank called. They need me to fill out some form online. I don't know what they mean.
You have to use the computer, Dad. No worries, I will help you. Hello?
Phyllis, Cousin Sandra's wedding is this weekend. I don't have a gift yet. Can you pick something up for me?
Yes, sir. It might be a little later in the week, but I will take care of it for you. Hello?
Phyllis, I know I said I would be able to sit with your dad while you take a day for yourself, but my daughter just won a school award, and the presentation ceremony is the same day. I'm sorry, but I just can't miss this.
It's okay. I understand. Hello?
Phyllis, I made a doctor's appointment for Wednesday at 10 o'clock. Will you be able to take me?
I should be able to do that. If not, I'll find someone who can. Hello?
This is Dr. Dickerson's office. I'm calling to discuss the care plan for your dad. He is going to need reliable transportation to his dialysis appointments. Will you be able to do that for him?
Yeah, I'll figure out something. Hello?
Phyllis, I sure would love to hear a Bible story, but I can't find my Bible or my glasses. Do you think you could read some for me tonight?
I have to go to Liam's game, but I will come by on the way home. Hello?
Phyllis, I stopped by to see your dad today and something in his house smelled really bad. I'm not sure where the smell was coming from, but I thought you might want to know.
Oh my gosh. Yeah, I'll stop by on the way home from work. Thanks for letting me know. Hello?
Phyllis, do you remember how I used to make pecan pies for Thanksgiving? Everyone always looked forward to them. Do you think you could help me with that this year?
Sure, Dad. I'm a little pressed for time right now, but I promise we will do it together. Who is a family caregiver? According to Public Law 109-442, the Lifespan Respite Care Act of 2006, the term family caregiver means an unpaid family member, a foster parent, or another unpaid adult who provides in-home monitoring, management, supervision, or treatment of a child or adult with a special need. This could include spouses, parents taking care of children, adult children taking care of spouses, and other relatives. So what do caregivers do? Caregivers provide personal care, and that could mean something like helping a person brush their teeth, comb their hair, to get a bath, to get dressed, to put on makeup. Caregivers offer emotional support. That could be listening and encouraging the individual who is suffering from a disease or disability. It could be as a connection to the individual's faith resources, making sure they get to listen to online services, reading to them. Caregivers often are the ones who are in charge of application of medicine, be that oral, an injection, changes of bandages, or even putting on braces. Household management, that could mean making sure the bills are paid and the checkbook is balanced, noticing if there are any repairs that need to be made to the home and seeking out an individual who can address those repairs. Supervision, An individual needs to remain as independent as possible, but that has to happen within safe parameters. So a caregiver may monitor an individual and make sure that they're kept safe. Translation services in a medical setting, that could be a language barrier, or it could simply be a terminology barrier, because a lot of times individuals don't understand some of the terminology that are used by professional medical staff. So understanding the progression of their disease or disability as well as its treatment might be a bit of a challenge. What is the impact of caregiving? Caregivers are quite often on call 24 hours a day. They may have a job and a family of their own to take care of, but they also know that they are a phone call away and they could have a pressing matter that needs to be dealt with at any moment. This high level of emotional and physical strain can often create something that's called caregiver stress, and the effects of stress include depression and anxiety, weakened immune system, obesity, increased risk of chronic disease, short-term memory loss, or becoming distracted easily. Think about the big picture for a second as I read to you a quote from the Office of Women's Health. Most Americans will be informal caregivers at some point during their lives. A 2012 survey found that 36% of Americans provided unpaid care to another adult with an illness or disability in the past year. That percentage is expected to go up as the proportion of people in the United States who are elderly increases. Also, changes in health care mean family caregivers now provide more home-based medical care. Nearly half of the family caregivers in the survey said they give injections or manage medicines daily. Also, most caregivers are women, and nearly 3 in 5 family caregivers have paid jobs in addition to their caregiving. To give you an idea about how valuable family caregiving services really are, take a look at the chart below. Notice that it says annual spending in billions of dollars. Compare Medicare and the value of unpaid family care. Medicare is $494.8 billion spent. In unpaid family care, $450 billion saved. To understand what a big deal that cost savings is, take a look at what the future holds. The age structure of the United States is undergoing tremendous change. By the year 2050, the population of individuals 65 years of age and older is projected to be 83.7 million. That is twice what it was in 2012. So what have we done so far to help family caregivers? In 2006, then Senator Clinton and Warner sponsored the Lifespan Respite Care Act. This law provided for respite programs at state and local levels. It had provisions for planned and emergency respite care. It provided for training and recruitment of respite workers and volunteers. It disseminated information to caregivers regarding respite services offered. It provided assistance for caregivers to access these services, and it established the National Resource Center on Lifespan Respite Care. Since 2009, $2.3 to $2.5 million per year has been allocated to fund this program. To get an idea of how money gets to a caregiver, let's take a look at the flow of funds. At the top, you notice the United States Department of Health and Human Services, commonly referred to as DHHS. This is a cabinet-level department, which means the secretary will report directly to and advise the president. It's also responsible for the creation of the organization called the Administration for Community Living, whose mission it is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. They are the grantor of funds. These funds trickle down to state programs who earn them through competitive grants. In North Carolina, it's referred to as the Family Caregiver Support Program, so they would be the grantees. From there, the state program would disperse the funds out to other agencies. The agency that I used is called the North Carolina Respite Care Coalition, which is a nonprofit grassroots network. From there, they will disperse funds to caregivers to pay for respite care services. And Alicia Blader of the Family Caregiver Support Program in Raleigh described to me a scenario whereby a caregiver might use these funds. For instance, if you are a family caregiver and you have a family member who resides outside of the home, you could pay for transportation services to get that individual to come to your home and stay with your loved one so that you could have a break. Goals of the Lifespan Respite Care Act are to increase the quality and quantity of the services that are available. Number one, we need to increase the awareness of what respite care services are actually available right now. And then we need to streamline the process for individuals to acquire those services. Additionally, we need to expand the services and or the programs that are already in place, because so many times these programs have waiting lists. We need to help individuals remain independent for as long as possible, keeping them in their homes and active in their communities, because this will help delay entry into institutionalized care facilities, and it will make the most effective use of the public funds we have available. In order to meet these goals, we have to increase funding for respite care. That's where you come in. The Lifespan Respite Care Reauthorization Act of 2015 was introduced to the House on November the 3rd of this year. This new legislation would increase funding to $75 million over the next 5 years. Please contact a representative by calling 202-225-3121 or by visiting the website listed below. Let your representative know how much we appreciate our family caregivers, that we recognize the valuable service they're providing society, and that we know how important it is that we protect their physical and mental health by providing them with respite care services.